Tips from Dr. T, your best dental resource. Today we're gonna talk about crowns, something that's done very commonly in order to save your teeth and improve aesthetics of your teeth. Let's go. Let's begin with what are crowns. Crown is coverage over your entire tooth. It covers the entire tooth, front, back, side, and it's usually made out of porcelain, but we have different materials. We have porcelain fused to metal. We have zirconia, which is made out of lava. It's as strong as metal, but it has no metal in it. And those are the most common types of crowns. There's also still some people like gold, so there are gold crowns as well. And again, crown goes over the entire tooth, covers the entire tooth, and gives it a strength so it can last longer and hold up better. Here you go. This is a good example of crown. I did another Google for you. Google Doctor helps a lot, right? So if you type in crown, this is a crown actually. You shave down the tooth all the way around the tooth, and then the porcelain, metal, porcelain, gold, doesn't matter, whatever material that is, comes and covers the entire tooth over it. So it has a strength of actual tooth because the cusps and everything, the structure that goes into the bite, it's all made out of porcelain or gold or the material that's really strong and can hold forces of bite and chewing. Why do you need crowns, or why should you get crowns? There are several reasons of getting crowns. The main reason is you have existing filling that's huge and it's covering over cusps. Cusps are the areas of the teeth that actually, when you function, they go hit each other and go into function. And that's where you chew food and everything. So if that is undermined because there's such a big filling, you have a high risk of breaking it. And that's why you should get a crown instead of a filling in order to protect your tooth and prevent fractures and also prevent losing the teeth. The other reason patients sometimes need a crown is when they do smile makeover. Instead of doing a veneer, you might want to get a crown because of function, aesthetics sometimes, and also if you are extreme grinder, clincher, veneers may not be the best choice for you, so you have to do a crown, cover the entire tooth to protect it and have it stand against forces breaking and fracturing or coming off. If in that case, veneers would do that, or maybe a filling material can do that, so you have to go with a crown in order to protect it for longevity purposes. There are different types of crowns, of course. One is gold. Gold used to be a standard long time ago. Why gold is good? The margins when you do a gold, because gold material is made out of metal gold, it can be designed to a thinnest fine margins without breaking. Because it can be so thin, you can prep teeth more conservatively. So gold used to be the most standard, but as things change during time in society, people stayed away from gold because of aesthetic reasons. The other option is porcelain fused to metal. We have a metal substructure with porcelain over that. The downside of that is over time, you start seeing dark lines at the gum margin, and patients did not like that because of aesthetic purposes of it. Also had chance of breaking porcelain. Option number 3 is clear crowns. They fall into 2 categories. One is called Emax, the other part is called zirconia. Zirconia is a stronger material. They withstand more forces than Emax can, and when you have extreme grinding, you might want to consider something more like zirconia made out of lava material. However, both of them are very strong, both of them are very durable, and they can function really good and last for a very long time. The benefit of onlay is you can prep teeth more conservatively. The downside of that is now you have more tooth structure to clean because the contact between the tooth and the porcelain material is increased because you're going up and down to create that instead of just going straight down. And you just have to make sure you clean it so you don't get cavities around the teeth. So it has pros, it has cons, but we have to balance it out and see what works best for patient. And each patient is different. Sometimes you want to be more conservative on the tooth structure. Sometimes you can be conservative. You just have to go more and cover more of porcelain material around the teeth. Let's talk about longevity. You're spending so much money and doing such a big investment, you probably want to know how much lasts, right? When you go buy a Gucci bag, you're like, how much does my Gucci bag last? I want to spend so much money. I can get a $20 at Walmart, but spend $1,000, right? So that's the same thing. How much does your crown last? It can go anywhere from 2 years to 20 years to 30 years. The more sugar you eat, the more instructions you don't follow, such as brushing, flossing, the less it's gonna last you. The more you brush, the more you floss, less sugar you take, the longer they're gonna last you. So that's why there's such a big window, 2 years to 30 years. People who follow good instructions and they have a good oral hygiene, you're pushing more than 10 plus, 20 plus years. But people who don't have the good instructions, which everyone I know, you guys love flossing, that's gonna last less just because eventually bacteria leaks under the crown between the contact point of crown and tooth, and it can develop decay and cavity and end up with needing it replaced. All right, let's talk about pros and cons of crowns. The main pro of the crown is because it covers the entire tooth, it prevents breaking and fracturing of the teeth farther. The con is it costs money. One of the most number one complaint patients have is, why does it cost so much? And number two is, why do you have to shave off so much of my tooth structure? So we don't just go in and shave it off. You already had it shaved off probably by having such a big, large filling in your tooth. When we shave it off, we just remove those fillings that you already have and cover that with porcelain, which is gonna help your teeth last longer and protect it for a longer period of time for you. Alternative options to crowns are usually fillings. However, if you can have a filling, you should get a filling. You shouldn't get a crown. But if you really have to have a crown, you should not be getting a filling. So is there really any alternative? Probably not, because when you need a crown, that means your tooth is undermined around the cusps and you have to have a crown in order to protect it for long term. So if you go with anything else, you're actually compromising the longevity of that. It's kind of like if you get a hole in your tire and it's kind of borderline of one area that can be repaired but it shouldn't be repaired. You're like, you know what, I'm just gonna feel like being cheap today and just let's repair it, I'll be fine. And then you go down on the street and it breaks off. The hole, it's just busted and now you're kind of screwed. It's the same thing with the teeth. You go for Thanksgiving dinner or Christmas Eve dinner or whatever, and then you bite down on something and it breaks off because you didn't want to do a crown and you wanted to do a large filling. So that's the downside of getting a large filling compared to getting actual crown that can protect your teeth for a longer period of time. There's also another category of crowns that's like a partial crown. It's called onlay, and it's made out of porcelain material, but it covers part of the tooth, not the entire part, the entire coverage of all the way around the tooth. You can have that option. It's again not very common, and the reason for that is if you're doing something that's covering the tooth, you might as well cover the entire tooth instead of part of it. And it's usually taught in schools, but when you come out, it's not as common just because, again, for functionality and durability. As always, make sure to consult with your dentist and pick their brain as far as what's the best option for you, so you know all the pros and cons that can affect the outcome and you make the best decision that's best for you.